Hello, my name's Hans. I'm going to be your student nurse today. How are you doing?
Good.
Good. Can I ask you your name and date of birth?
Thelma Humphreys, 9/13/1937.
Alright, Thelma. Can I check your wristband?
Yep.
Thelma Humphrey, 9/13/1937. Alright, Thelma. So I'm in here today to give you your insulin for your high blood sugar. Have you taken this before?
Yep.
Alright, do you have any allergies?
No.
Alright, well, some side effects that can happen with this insulin is just dry mouth, blurred vision, nausea, low blood sugar, but lowest blood sugar is what we're trying to accomplish here. So hopefully that happens. Do you have any preferred spot you like it?
On my abdomen.
On your abdomen? Okay, which side do they normally poke you?
They poke me on my left, so can you do it on my right?
Sure, I'll do it on your right side. And then one important thing you need to do before, right after this, is eat. They're bringing breakfast in at 8 o'clock. It's 7:45 right now. And your insulin is scheduled for 7:30 and 8 o'clock between the two types of insulins. So we're right in that time frame at 7:45, but you need to eat your breakfast when they bring it in so that your blood sugar maintains a steady level. Is that okay?
Yep.
Cool, all right, I'll be right back. Call light's right next to you, right here. Bed's at lowest position. Call me if you need anything. I'm just gonna be getting your meds ready. Going to the non-disruption area, prepare the meds. Alrighty, so the Mars says NPH 10 units sub-Q at 8 o'clock. And insulin Lispro 2 units subcutaneous at 7:30 with breakfast for Thelma Humphreys, date of birth 9/13/1937. The physician's order says for Thelma Humphreys 9/13/1937 for NPH 10 units subcutaneous injection at 8 o'clock, and insulin Lispro 2 units subcutaneous at breakfast, lunch and dinner, but mainly eat with it. All right, and she has no allergies. I asked her that. Okay, MAR and physician's order link up. I'm going to prepare my medications. Okay, so we have our labels, our units. Okay, now that we have our medication out, we're going to compare our Lispro. Let's see here, Lispro not expired. Both of these medications are not expired, so they should be good to go. Our Lispro here should be 2 units on the MAR. 2 units, yep, Lispro subcutaneous at 7:30 for Thelma Humphreys, and NPH for 10 units at 8 o'clock subcutaneous injection. For 8 o'clock for Thelma Humphreys, date of birth 1937. Case of the MAR. Physician's order matches up. Lispro 2 units sub-Q and NPH 10 units sub-Q. That's what we have for Thelma Humphreys, 9/13/1937. Alrighty, so now that we have our correct medications down, I'm going to perform hand hygiene, get some gloves on, and prepare the medication. Alrighty, so I'm going to make sure there's no contaminants. No contaminants. No contaminants. Okay, so I'm going to go ahead and roll our medication to get it ready. You don't want to shake it because then you'll mess up the properties of the medication. Roll the other one as well. Alright, next we're going to clean it. Different alcohol pad for different medications. Clean vigorously and let the alcohol dry. Same on this. Clean vigorous. Let the alcohol dry. And because we want NPH first, excuse me, just disregard that. So we have 10 units of NPH and 2 units of Lispro. So we want is 12 units of air. So what I'm going to do is I'm going to take this cap off. I'm going to take out 12 units of air to push back into my medications. Now I'm going to have a registered nurse next to me confirm 12 units.
Mm-hmm.
All right, I'm going to push 10 units into our NPH. All right, 10 units. All right, and then we're going to push 2 units into the Lispro. Confirming 2 units.
Yep.
All right, the last 2 units, and then we're going to draw up 2 units of Lispro with my registered nurse next to me, confirming that it's 2 units.
Yep.
And then the last 10 units equaling to 12 with NPH. And I'm going to keep my bottle in to confirm with my registered nurse. 12 units.
Mm-hmm.
Perfect. Now that we have our medication, I'm going to use the scoop method. Scoop up the medication, cap it with safety precautions and not poking myself. I'm going to label it because we're in a different room. I'm going to put my insulin back in the refrigerator. Discard it as needed. Discard my trash. I'm going to take my gloves off. I'm going to take my label, double check with my MR, NPH 10 units, Lispro 2 units, NPH 10 units, Lispro 2 units for Thelma Humphreys at 8 o'clock and 7:30. So it's 7:45, we're right in that time period. And we're going to double check with the physician's order with the MR and the label. NPH 10 units, subcutaneous, Lispro 2 units, subcutaneous, and NPH 10 units, Lispro 2 units, 7:45 for Thelma Humphrey, date of birth 9/13/1937. All right, so now that we've confirmed that, I'm going to perform hand hygiene. We're going to go back to Thelma's room. Hello, how are you doing?
Good.
Good. Can I ask you your name and date of birth?
Thelma Humphreys, 9/13/1937.
Awesome. And then can I just see your wristband?
Yep.
All right, and then just double checking you don't have any allergies.
No.
All right, can you teach me again what side effects might occur?
Blur vision, dry mouth, and nausea and vomiting.
Alrighty, and you said what side they poke your stomach on?
They poked me on the left side.
Okay, awesome. So can I do your right side?
Yep.
Alrighty, I'm gonna pull your blanket down, get everything ready. Noting that's 2 inches from the umbilicus. Okay. I'm going to confirm now that I'm in my room. NPH 10 units, Lispro 2 units, NPH 10 units, Lispro 2 units. For Thelma Humphreys, 9/13/1937, 7:30 and 8 o'clock. That's what we have here. Same with the MAR, Lispro 2 units, NPH 10 units, both subcutaneous for Thelma Humphreys, 9/13/1937. All right, so we've done all our confirmations. I'm going to do my hand hygiene. All right. Okay, Thelma, so I'm going to pinch your stomach a little bit when I administer it. Okay. That's
Okay.
okay with you?
Yep, that's perfectly fine.
All right. Discard the label. Discard the label for confidentiality reasons. All right, you're gonna feel a little bit cold, okay?
Okay.
Clean in a circular motion. Subcutaneous is at a 45-degree angle. Take the pin off. Okay. You're gonna pinch 45. Administer. Take out. Safety goes on immediately to the sharps. Cotton. Clean up that dried blood. Hold it for a sec. Subcutaneous, so they shouldn't really bleed that much at all. Okay. Then I would discard up my stuff. Discarded. Hand hygiene. Make sure Miss Humphrey's comfy. Your head okay? Comfy?
Yep.
Call lights right here, okay, if you need anything.
Perfect.
Bed's lowest as it can be. Call me if you need anything. And I'm gonna go document everything and I'll see you around.
Okay.
Hand hygiene when leaving patient's room. On the documentation center. Outside. And then document that her MPH and Lispro was given her at the correct time, 7:45, but 8 o'clock and 7:30. All right. Correction, earlier I left without closing the MAR, the computer, logging out. I've been doing this today. I think it's because there's no computer there. But I'd like to make a correction that earlier when I left from documentation, the medication area to patient, I would sign out to protect me, the patient, and also me legally and liably. All right, thank you so much. Close, log out of the MAR. Hand hygiene, documented, shoots.